Welcome to The Exam Room with your host, Dr. Rhiannon Winsor. In this podcast, we explore how value-based care is transforming healthcare for the better. From probing today's challenges to charting innovative breakthroughs, we're here to dissect what's shaping the future of patient-centered healthcare. In this episode of The Exam Room, Dr. Darlene Melk and Dr. Shantipriya Siripurapu explore what it means to move beyond task completion in healthcare. Instead of focusing on activities like the number of calls made, the conversation centers on achieving meaningful outcomes, such as completed screenings and improved chronic disease management. The doctors highlight the importance of engaging both patients and caregivers, making every visit count, and using technology to enhance communication. They also discuss how risk stratification can help guide care planning and how primary care providers play a critical role in coordinating care across specialties. With a focus on real-time data, collaboration, and patient-centered care, this episode offers practical insights for teams looking to improve outcomes in community health.
What are some strategies that you have used at your health center, maybe Dr. Melk, that you could think of to move beyond these kind of checklist things towards really improving patient outcomes?
This topic kind of reminds me a little bit about the public health concept of measuring processes versus outcomes, So, rather than having, let's say, if we have a team assigned to breast cancer screenings, rather than saying you need to make 20 calls a day and that be the goal, we would say we want you to track how many breast or mammographies were completed in a week or a month, right? So actually the completion is the outcome, not just the process. And then the other kind of example I thought of is when we do have patients that come in for acute reasons, taking advantage of that moment, especially let's say during flu season. And maybe they already had their annual a few months ago, but it wasn't time for their flu shot. But that we train our medical support staff to open the immunization template for every visit regardless and really promote the flu vaccine and take advantage of that moment that patient took the time out of their busy day and they're there and we don't know when we'll see them again. And so taking advantage of those opportunities, giving vaccines are a great example because it can be quick and on the spot. So.
And from the patient perspective, it's more holistic care, right? Even if it's easy for me to get to the health center, if I don't have to come back, it's really nice that you actually are aware of me as a patient and you've looked at my chart or what my needs might be and you're helping me out with that. And I think patients really appreciate that too.
Yeah, I would like to mention that one of the strategies could be patient engagement. That's a very important strategy. If the patient is educated about their chronic condition, whether it is diabetes or high blood pressure, and why a breast cancer screening is important or why any other kind of screening is important, and then getting them engaged to do that, so that they understand that their A1C, their uncontrolled A1C can cause these problems. And that is why it is important to get that under control. And that they understand their diabetes, that they understand their blood sugars. That's how these measures have a better chance to be met. That goal can be met if the patient is engaged in their own healthcare. So education and getting them engaged in their own healthcare is one of the best strategies that can be implemented.
Yes, the patient is part of the team.
Yes. Yeah, without them understanding, there's no motivation on their part, and then more than likely they will not do what they are being told. So it is important for the patient to understand that why is my provider telling me to do this? It is for their own health, their own good health.
You were mentioning having the patient engaged, but I couldn't help but think that often patients also are dependent, even some of our seniors, on caregivers. Just a simple example, I'm a caregiver right now in my life, and so my mother does not navigate patient portal. She can't do any texting. She's really dependent on me. And our nurse care manager was trying to contact me during business hours, and I could never pick up the phone because I was working. And so being aware of the caregiver's life, and I said, how about using the portal as a way to message me about my mother rather than calling me? And it actually had our entire nurse care management team sort of take a fresh look at their approach, because they had just traditionally, I have to make a call, I think mostly for billing purposes too, but it just wasn't an effective way to reach me. And so I definitely agree with you, patient engagement, but would take it one step further to say caregiver.
Yeah. Caregiver training, as well as involving the caregiver in the sense that understanding their needs and what is the best way to approach them. And I think in FQHC term it is even more important, because a lot of our population fall into that category, where the patient himself or herself is not able to engage in that kind of communication, but their caregivers are, but they are working people, working class, so they have to make sure that they're sensitive to their timings and how to approach them.
That makes me think about in education, we always think about our learners and where they're at. And the same with our patients or with our caregivers. And I think it's really innovative, to think of ways to leverage the technology, the existing, structures that we already have, to maybe shift our way of thinking and do things a little bit differently. Meeting our patients where they are. They probably have a phone with them, a smart device. Most of us have those now. And how can we use that to make it easier for them, but also encourage their participation or their engagement as well? So my next question for you is about data, and we talked a little bit about that already and how difficult it is to get our hands on it. I know here we're working on rolling out dashboards so that our health centers will have more real-time access to that data. How does it play a role in the shift from us being task-oriented to more outcome-oriented, and what effective ways can we use it to drive patient care? What are your thoughts?
For me, I think it definitely is kind of one of the critical pieces in order for us to move the needle, because if we don't know where we're at, how are we going to know where we're going or what our goals are? We utilize at our health center Azara drives, and our quality teams pulls monthly dashboards so that the clinics and the clinicians individually have that data on quality measures specifically. We also are working on sort of getting more coding, auditing, and feedback just on HCC captures, specifically with our Medicare population. And then more recently, we're trying to utilize what we have within our EHR's abilities, but to look more at risk stratification so that can also help kind of drive how we assign our nurses to which patients are at highest risk, so that we're thoughtful about that. But no, the data, we all are saying we need it to be timely, accurate, and accessible to everyone. And that's kind of what we've done at our health centers. Anybody who wants access to Azara drives can have it. And now that we've tied incentives to it, everybody is curious, like, wait a minute, how is this patient assigned to me? And, of course, the arguments around attribution come into play, which again is why I like the team approach. That patient sees you or your colleague when you're not there, that we're all a team and we really do need to work together. But anyway, the data is really, really important. And yes, I look forward to the day when we have a fully interoperable, like HIE, that captures everything, ER visits, specialists, what they're doing, because they play a huge role in quality and also, total cost of care. And that, unfortunately, we, as a health center with only primary care providers, we don't have a lot of control or leverage over that, but at least we could have that awareness. And right now, we just get, if we're lucky, we get a scanned document from a cardiologist, for example. And so that would be a great piece of data that, if it were possible to be integrated into our system so that we were really aware at all times. But yeah, no, data is key, is the currency, right? Like, as they say.
Right. And it makes me think, if we're having trouble getting data in real time in a timely way, we might have the tendency to just kind of wait and not take a lot of action. Are there things that we can do in the meantime? You mentioned the EHR. Is there other things that we can do while we're waiting for this data and we don't really know, so that we're not just kind of resting on our laurels?
When you talk about data, I get the jitters. but at this time is when I would love to have Kim, who talks data like it's
Right.
she knows the back of her hand. But yeah, from what I hear from Kim, we are working on getting this dashboards ready for our FQHCs to just look at it and know where they stand at any particular period of time. There will still be a time lag on a lot of these things, but I'm hearing that time lag is going to decrease, maybe 4 to 6 weeks of time lag rather than 3 months that we used to have. And the team members are also going to get training on that as to how to look at these dashboards and understand what is going on and what it means, so that they can get on it. But to answer your question as to what can we use that we already have, we do have data. All the FQHCs have data from previous year as to who are the patients who did not get the mammograms done, who are the patients who have not had depression screening done, or blood pressure is uncontrolled, or patients who have blood pressure. So get them in for their first visit. Start looking at their blood pressure, manage their blood pressure. If they have not had an A1C in the last 3 months, start with an A1C, because the A1C in this particular year counts for diabetes. So that's how I would say start approaching your patients without even having the data that you have. Start with what you have already. You know your Medicare population. You have probably definitely have a list of your Medicare patients. So start from there, get them all in for their annual wellness visits if they are due. If they're not, they might be due for their blood pressure follow-up. They might be due for their diabetes screening. So that's how you start with what you have, rather than waiting for the data to come in, which I know is important, but it will come.
Dr. Melk, what about you? What are your thoughts?
So I mentioned earlier that we're just kind of, I wouldn't say at the beginning, but we're trying to really define how we are going to approach risk stratification. So it's not only to know potentially this patient should be assigned to a nurse care manager, or this patient can be managed maybe like by a care coordinator, but it also is going to help us drive our frequency of visits. I'm a pediatrician, but I have a panel of patients that have quite complex medical conditions. And at a minimum, I see them every 3 months because I know they've had a visit with the specialist. They probably adjusted their seizure medication or diabetes medication, whatever it is. And often that mother or father didn't quite understand what the provider said in the visit. And so in that visit with me, I'm able to pull up the record. If I don't have it, I request it. You know what I mean? So the risk stratification is also so that we can set the patient up on a cadence. It could be that they need to be seen every 3 to 4 months. If they maybe have 1 or 2 chronic but stable conditions like diabetes, hypertension. But let's say they have stage 4 renal failure, or they have cancer, maybe we need to see them every month, because there may be things that we don't know that are going on, and even all the social things that complicate things. So I am excited to kind of have this risk stratification procedure finalized, and really at the end of the day, the driver will be the PCP. The PCP can decide, I've had patients for social reasons I needed to see on a monthly basis. The family was going through a really tumultuous, divorce, or just lots of issues at home. So not necessarily even medical, but at the end of the day, does significantly impact their health and their mental health. And so, I was seeing them every month. So that's kind of the idea. And to answer your question about how do you stay ahead before you, wait for the data, that's it. That's getting them in. Because again, I'm the PCP, and I believe firmly, like I'm the hub, and I need to know and gather all the data in our EHR as best I can and be that consistent contact for the family.
Yep, I completely agree. When in my own clinic, I used to do the same. I would make sure patients with 2 or more chronic conditions would see us every 3 months. A lot of them would say, "Well, I'm seeing a specialist for that. What are you doing?" "Well, I'm pulling the strings together."
That's right. That's right.
I would say, a lot of times you don't know what, the other specialist does not know what this other specialist is doing. Especially I see that a lot between cardiologist and nephrologist. Nephrologist is adjusting medication. Cardiologist is adjusting medication. Patient is saying one medication of the same kind with 2 different doses. So I'm the one who will fix that. If you come to me, I'll tell you this is what you're supposed to be taking. That's where PCP's role comes in, and it is very important for everyone to understand that role and have that regular follow-up.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care, and thanks for listening to The Exam Room.